Medicare enrollment deadlines can cost you thousands of dollars in permanent penalties if you miss them. I'm talking about penalties that last for the rest of your life, adding up month after month, year after year. Let me show you exactly when Medicare starts, what triggers your enrollment window, and what happens if you miss it. Medicare doesn't just automatically start when you turn 65. That's the first misconception that gets people into trouble. Your enrollment is tied to specific dates, and understanding these dates is critical because missing them by even one day can trigger consequences that follow you forever. Let's start with the basics. Medicare has what's called an Initial Enrollment Period, or IEP. This is a 7-month window that surrounds your 65th birthday. It includes the 3 months before your birthday month itself, and the 3 months after. So if you were born on June 15th, your IEP would run from March 1st through September 30th. But here's where it gets tricky. When you actually enroll during that window determines when your coverage starts. Enroll during the 3 months before your birthday month, and coverage begins on the first day of your birthday month. Sign up during your birthday month, and you're looking at coverage starting the following month. Wait until the months after your birthday, and you're adding even more delay. Why does this matter? Because gaps in coverage are exactly what trigger those lifetime penalties. Now, if you're still working at 65 and covered by an employer health plan, you might qualify for a special enrollment period. This is crucial. You don't have to enroll in Medicare at 65 if you have what's called creditable coverage through your employer. The key word there is creditable, meaning coverage that's at least as good as Medicare. The size of your employer matters here. If your company has 20 or more employees, your employer coverage is typically primary, and Medicare would be secondary if you enrolled. In this situation, you can delay Medicare Part B without penalty. Drop below that 20-employee threshold, and Medicare becomes primary, which changes the entire calculation. Here's what most people don't realize. When you do eventually leave that employer coverage, you get another 8-month window to enroll in Medicare without penalty. But that 8 months starts the month after your employment ends or your group coverage ends, whichever happens first. Miss that 8-month window, and you're back to facing penalties. Let me give you a real scenario. Say you retire in March. Your employer coverage ends March 31st. Your 8-month special enrollment period starts April 1st and runs through November 30th. Enroll any time during that window and you're fine. Wait until December. You've missed it, and now you're stuck waiting for the General Enrollment Period. The General Enrollment Period runs from January 1st through March 31st every year. This is your backup option if you missed your initial enrollment period and don't qualify for a special enrollment period. But enrolling during this window means 2 things. First, your coverage doesn't start until July 1st. Second, and this is the painful part, you'll face late enrollment penalties. Those penalties are calculated based on how long you went without coverage when you should have had it. For Part B, which covers doctor visits and outpatient services, the penalty is 10% of the standard premium for each full 12-month period you were eligible but didn't enroll. That percentage gets added to your premium permanently. Let me break down what permanent actually means. You're 66. You missed your enrollment window by 2 full years, and now you're signing up. Your penalty is 20% of the Part B premium, added to every monthly payment for as long as you live. If the standard Part B premium is $174.70, you're paying an extra $34.94 every single month. Over 20 years, that's $8,385 in penalties alone. Part D prescription drug coverage has its own penalty structure. This one's calculated differently. Take the national base beneficiary premium, multiply it by 1%, then multiply that by the number of full months you were eligible but didn't have creditable drug coverage. That amount also gets added to your monthly premium for as long as you have Part D coverage. The math might seem abstract until you see it play out. Someone who delayed Part D enrollment for 36 months could be paying an extra $13 per month in penalties. Again, this isn't temporary. It's every month, forever. But wait, there's another layer to this. Medicare Advantage plans, which are Part C, follow the same enrollment periods as original Medicare. However, you need both Part A and Part B to enroll in an Advantage plan. If you delayed Part B and now you're facing penalties, those penalties apply whether you choose original Medicare or Medicare Advantage. Part A is often free if you or your spouse paid Medicare taxes for at least 40 quarters. Because it's free for most people, there's typically no penalty for late enrollment. The exception, if you have to pay a premium for Part A because you don't have enough work credits, then yes, there's a penalty. It's 10% of the premium, and it lasts for twice the number of years you delayed enrollment. Let's talk about a situation that confuses almost everyone: COBRA coverage. If you're on COBRA when you turn 65, that does not count as creditable coverage for delaying Medicare. You need to enroll in Medicare during your initial enrollment period, even if you're still on COBRA. The same goes for retiree coverage in many cases. Some retiree plans are creditable, others aren't. You need to verify this in writing from your plan administrator. Here's a question I get constantly. What if you're covered under your spouse's employer plan? The same rules apply. If your spouse works for a company with 20 or more employees, you can delay Medicare Part B, smaller than that, and you should enroll at 65. When your spouse retires, or you lose that coverage for any reason, your 8-month special enrollment period begins. The documentation matters more than people think. When you enroll during a special enrollment period, you'll need proof of your prior coverage. That means letters from your employer or insurance company showing when your coverage started and ended. Without proper documentation, Social Security might not recognize your special enrollment period, which means you could end up with penalties even though you thought you were protected. Some people try to game the system. They think they can skip Medicare, avoid the premiums, and just sign up later when they need it. This backfires spectacularly. Not only do you face the lifetime penalties, but you also create gaps in coverage during a time in life when health issues become more common. One unexpected medical event during that gap could cost you more than years of premiums. There's also the issue of Medicare supplement plans, also called Medigap. These plans have their own enrollment protections. When you first enroll in Medicare Part B, you get a 6-month Medigap open enrollment period. During this time, insurance companies can't deny you coverage or charge you more based on health conditions. Miss this window, and you might face medical underwriting later, which could mean higher premiums or even denial of coverage. So what should you actually do? 3 months before you turn 65, assess your situation. Are you still working? Does your employer have 20 or more employees? Is your coverage through your employer, or are you on COBRA or retiree coverage? Get written confirmation about whether your coverage is creditable. Then make your decision about when to enroll. If you're retiring around 65, enroll in Medicare during the 3 months before your birthday month. This ensures coverage starts right when you need it. If you're continuing to work with creditable coverage, document everything. Keep letters, emails, and plan documents that prove your coverage dates. Understanding these timelines isn't just about avoiding penalties. It's about ensuring you have continuous health coverage during a phase of life when you're statistically more likely to need it. The enrollment rules might seem bureaucratic and complicated, but they exist for a reason. Medicare needs a stable risk pool, and these rules help maintain that. What I haven't covered yet are the specific situations that create exceptions to these rules, the state-level programs that can help with costs, and the strategies for minimizing your overall Medicare expenses, even if you do face penalties. Those details change the calculation significantly. Let's talk about those exceptions and special situations that change everything I just outlined. First, people with end-stage renal disease, or ESRD. If you have permanent kidney failure requiring dialysis or a transplant, different rules apply. You can't enroll in a Medicare Advantage plan when you first become eligible, though recent rule changes have loosened some restrictions. The penalties still apply if you miss enrollment periods, but your coverage options look different from the standard Medicare population. Then there's disability. If you've been receiving Social Security disability benefits for 24 months, you automatically get enrolled in Medicare, regardless of your age. This happens even if you're in your 40s or 50s. The same penalty rules apply if you drop coverage and try to re-enroll later. But the timeline shifts based on when your disability coverage began, rather than when you turn 65. Now here's something most people overlook. Medicare savings programs. These state-administered programs help pay Medicare premiums, deductibles, and co-payments for people with limited income and resources. There are 4 types: QMB, SLMB, QI, and QDWI. Each has different income limits and covers different costs. The Qualified Medicare Beneficiary Program, or QMB, covers both Part A and Part B premiums plus cost sharing. That's massive if you qualify. The income limits change annually, but we're generally talking about individuals earning around $1,500 per month, or couples around $2,000. Assets matter too, usually limited to around $9,000 for individuals or $14,000 for couples, not counting your home or car. The Specified Low-Income Medicare Beneficiary Program, SLMB, covers Part B premiums only. Income limits sit slightly higher than QMB. The Qualifying Individual Program, QI, also covers Part B premiums, but has even higher income thresholds and limited funding that runs on a first-come basis each year. Apply early if you think you might qualify. What about the penalties themselves? Can they ever be reduced or eliminated? In limited cases, yes. Social Security can grant equitable relief if you can prove the agency gave you incorrect information that led to your late enrollment. This is rare and requires documentation. You need proof that you asked, proof of what you were told, and proof that you relied on that information. Saying you didn't understand the rules won't cut it. You need evidence that Social Security itself misled you. Another exception involves state pharmaceutical assistance programs. Some states offer programs that help with prescription drug costs. These sometimes coordinate with Medicare Part D, and a few states have provisions that help with late enrollment penalties. Check your state's health insurance assistance program, called SHIP, for details specific to your location. Let's discuss strategy for minimizing overall costs, even with penalties. If you're facing a Part B penalty, you can't avoid it, but you can optimize around it. Medicare Advantage plans sometimes offer additional benefits that offset costs. Zero-premium Medicare Advantage plans exist in many areas. You'd still pay the Part B premium plus any penalty, but you might get dental, vision, or hearing coverage included. Compare that to Original Medicare, plus a separate supplement plan, plus a Part D plan, plus standalone dental and vision. Run the actual numbers for your situation. Part D penalties are different because they're based on the national base beneficiary premium, which changes annually. If the base premium increases, your penalty increases proportionally. That compounds over time. Getting into any creditable Part D coverage stops the penalty from growing, even if it doesn't eliminate what's already accumulated. A Medicare Advantage plan with drug coverage counts. So does employer coverage if it's creditable. Here's a scenario many people face. You retire at 63, take COBRA for 18 months, then hit 65 while still on COBRA. COBRA is not creditable for Medicare purposes. You should have enrolled in Medicare at 65. If you wait until COBRA ends at 66.5 years old, you've now got penalties building. The correct move is enrolling in Medicare when you turn 65, even if COBRA is still available. You can keep COBRA as secondary insurance if you want, though that's usually not cost-effective. What about people who move back to the United States after living abroad? If you're a US citizen who worked in the US long enough to qualify for premium-free Part A, your initial enrollment period is still based on when you turn 65. Living overseas doesn't extend it. If you return to the US at 68 and enroll then, you're facing penalties unless you had creditable coverage through an international plan, which is extremely rare. Most international insurance doesn't meet Medicare's creditable coverage standards. Veterans ask about VA coverage constantly. VA benefits alone do not count as creditable coverage for Medicare purposes. You can use both VA and Medicare together, and many veterans do exactly that. But skipping Medicare because you have VA coverage leaves you exposed to penalties if you later want Medicare. Some VA plans, particularly TRICARE, do coordinate with Medicare in specific ways, but standard VA healthcare benefits don't prevent penalties. The psychological aspect matters too. Some people skip Medicare Part B because they resent paying premiums for coverage they're not using. That's understandable but short-sighted. The penalties accumulate faster than you think. A 10% annual penalty means after 10 years, you're paying 100% more. That doubling happens at the point in life when you're most likely to need extensive healthcare. Paying the standard premium during healthy years is the price of protection during sick years. Let's address one more complexity: state-specific rules around Medicare supplement underwriting. Federal law guarantees your Medigap open enrollment period for 6 months after enrolling in Part B at 65 or older. But what happens if you delay Part B, then enroll later? You've missed that federal protection. Some states offer additional protections. California, for example, has birthday rule provisions. New York and a few others use community rating. Research your specific state's rules because they vary dramatically. One final consideration is the interplay between Medicare decisions and Social Security claiming decisions. They're separate systems with separate rules, but they intersect. If you claim Social Security before 65, you'll automatically be enrolled in Medicare Part A when you turn 65. Part B is optional, but you'll receive enrollment information. If you're still working with creditable coverage, you can decline Part B, but you need to be proactive about it. Silence doesn't protect you. The penalty system exists to discourage cherry-picking. Medicare works because it spreads risk across both healthy and sick beneficiaries. If everyone could wait until they got sick to enroll, the system collapses. Understanding that logic doesn't make the penalties less frustrating, but it explains why they're structured this way and why exceptions are limited. Your best defense is information, documentation, and timely action. Treat your 65th birthday like a financial deadline, because that's exactly what it is. Medicare enrollment isn't something you can afford to figure out later. The rules are complex, the timelines are strict, and the penalties are permanent. Missing your enrollment window by even a few months creates financial consequences that compound over decades. Mark your calendar 3 months before your 65th birthday. Assess your coverage situation. Get documentation in writing. Make informed decisions based on your specific circumstances, not assumptions or what worked for someone else. If you're still working with creditable employer coverage, document everything and understand exactly when your special enrollment period begins. If you're retiring near 65, enroll early to avoid gaps. The system doesn't reward procrastination. It punishes it with penalties that last the rest of your life. Take the time now to get this right, because fixing mistakes later either isn't possible or costs significantly more than doing it correctly the first time.